Now, the today topic of my class is common surgical intervention, and it is very difficult to cover all the common surgical intervention, but at least some most common surgical intervention I would like to cover in this class. First one is sterilization. Sterilization, as you know, is a surgical procedure in which our aim is to stop reproductive activity by removing this either testicle or ovary. In this, the term is castration. You know, this is used for removal of testicle or removal of ovary. This is used for both, either for removal of testicle or for removal of ovary, but it is most commonly used for the removal of testicle. And spaying is the term used for the removal of ovaries. And in this, ovary to me is the term used for the removal of diseased ovary, in which you think that there is some diseased condition in which it cannot be cured, then in that particular thing, removal of ovary is recommended, and that is diseased removal ovary. Removal of diseased ovary is known as ovary. Now castration, you know, this is indication of the castration, most commonly used to prevent this breeding nuisance, and it is also used for the domesticated animals, and in case of diseased condition like prostatic hyperplasia, perineal hernia, or any type of neoplastic or crushing injury which affect the condition of the testicles. These are the some important indications of this castration. Age of the castration is most important, and usually after castration has been done at the age of 9 to 12 months, which is the sexual maturity of the male dog. And site of operation, you know, this is the pre-scrotal site. You can put incision over here. I will discuss it later. And just by simple ligation of all these things, first of all, I would like to discuss anatomy here. Anatomy, most important anatomical vessels is spermatic vessels, external pubic vessels, and nerve supply in these conditions are this spermatic nerve, branches of second and third lumbar spinal nerve. These are the important nerves and blood supply which you have to remember, that where this nerve supply is there. So mainly nerve supply is through spermatic nerve and branches of second and third lumbar spinal nerves. And you know, mostly this type of surgery in case of dogs always has been done under general anesthesia. It's not easy to perform under this local anesthesia. So this important anatomical blood supply and blood supply is important. Now anesthesia, you know, pre-anesthetics, atropine, glycopyrrolate, gelazine. This is most commonly used in gelazine, ketamine, or gelazine, propofol, even atropine, diazepam, and thiopental for induction and maintenance by these inhalants anesthesia, or either by ketamine or propofol. These are the many anesthetic combination which used to which I am not going to discuss here, but at least you know basic things, because general anesthesia is important here for the castration or spaying any type of this type of surgery in case of dog. Surgical technique, this is the open method and closed method. Closed method, you know, this is most commonly used in case of large animals like Bordeaux castrator, in which you used to crush this spermatic cord. But in case of dog, in case of cat, even in case of goat also many times, this open method is most commonly used. This is open uncovered and open covered. Open covered means you are not going to incise tunica vaginalis. Means open covered means this tunica vaginalis will cover the testicle. You are not going to incise this tunica vaginalis. If tunica vaginalis is not, you are not going to incise this tunica vaginalis, it means that you are going to perform castration by open covered method. But if you are going to incise this tunica vaginalis, then this is known as uncovered, means you are going to incise and you are going to expose all these testicles. So these are the two important method, open in open method, open covered and open uncovered. In case of open covered, you are not going to incise tunica vaginalis, but in case of open uncovered, you are going to incise tunica vaginalis also. This is the important difference between these covered and uncovered. These are the some pictures. The incision is given either roughy or this in this groin area, and you are through this incision, you will expose these testicles, and by ligating these pampiniform plexus and all this blood supply, this picture, this is the pampiniform plexus, and by putting this artery forceps here, you just make ligation here so that blood supply will be hindered, and simply by just cutting this is very simple surgery, and you can easily perform even in field conditions also by giving this anesthesia. Complications is very important. Sometimes what happens, hemorrhage will be seen. So if you are going to ligate this all the pampiniform plexus and this blood supply, then chances of hemorrhage will be less here. The next one is pain. This type of complication is mostly seen in many type of surgery, but post-operative analgesia we used to recommend for this. And self-trauma, sometimes what self-mutilation is there. If you are not going to put this Elizabeth collar and all these things, then what will happen? Animal will bite the surgical site, and this is the most common complications seen in case of dog and cat. And swelling, whenever any surgical site is there, if you are not going to, then automatically we will use to give this anti-inflammatory NSAIDs, all these things. So these are the some common anesthetic complications of castration. Then ovarian hysterectomy. Ovarian hysterectomy is recommended for either if animal is having pyometra, or if animal is, if we are interested for this, prevent this reproductive ability of these animals, then this ovarian hysterectomy is recommended. You see here in this case, this ovarian cyst is there. This is uterine heart. This is uterine body. This is uterine body, and this is uterine artery, ovarian artery. So ovarian artery, and this is here one uterine artery is there. So we have to ligate these both blood supply. Then only it is possible to prevent hemorrhage. Otherwise, what will happen if simple अगर आप यहाँ छोड़ते हैं, थोड़ा सा भी मिस करेंगे, if you will miss here ligation of this ovarian artery and uterine artery, then what will happen? Severe bleeding will be there. So be cautious regarding this. Indications: pyometra, ovarian cyst, uterine torsion, uterine prolapse. These are the if animal is having uterine cancer, just to prevent pregnancy and just to avoid heat cycle. These are the recommendations, indications for this ovarian hysterectomy. Age, age of spaying is around 6 months. Above 6 months is best site. In between 6 and 12 months, either before or after the first estrus. Try to avoid this ovarian hysterectomy during estrus period, because blood supply will be there, and if you are going to perform this ovarian hysterectomy during estrus period, then chances of severe bleeding will be there. And this is a site of operation. Site of operation is a midline approach, 2 centimeter posterior, 2 centimeter posterior to umbilicus. These are the site. These are the umbilicus. This is umbilicus. Just 2 centimeter posterior to umbilicus is the best site for midline approach. Right ventral, right lateral recumbency is also recommended, and but this side is very easy and you can perform it very easily. But complications of this side is, if wound dehiscence is there, then what will happen? Whole organ will come out through this. And flank approach, oblique incision is right and mid flank. This I used to perform here in our TVCC. This is also best site here. Chances of evisceration of internal organ is very less. Suppose if dehiscence of wound is there, then chances of this evisceration of this internal organs like liver, intestine, all these things is less. These are the some artery and venous uh, supply of this uterus, artery and venous. This is umbilical artery, and main artery is uterine artery and this ovarian artery, which we have to ligate perfectly. Otherwise, chances of bleeding will be there. Surgical techniques. This is very important. Just you restrain animal in dorsal recumbency and a long incision. Already I have discussed 2 centimeter posterior to umbilicus is made, and is incision extended up to peritoneum by cutting muscles and then peritoneum, and the uterine horn is easily to grasp by thumb forceps, followed up to ovary, and by ligating this both ovarian artery of both sides, and just after ligation you cut it, and then you go for this uterine body. Uterine cut it by this ligating this utero ovarian vessels. Just cut it, and this is very simple surgery. It will take hardly 15 to 20 minutes for this removal of this whole ovary and uterine artery. These are the procedures. Ovarian versa is cut and ligation of already I have discussed these things, and if time will permit, then I will demonstrate this practically. This is the uterine body. First, this is the uterine horn. This is the second uterine horn. This is the ovary. This here ovarian artery is there. Ligating this ovarian artery, and this after ligation of these both ovarian artery of both sides, ultimately you reach here for the ligation of uterine vessels. Complications, evisceration, already I have discussed. This is the most common complications of this evisceration. If site is not properly closed, then chances of abdominal hernia will be also there. Sometimes if infection is there, then suppuration, and if suppuration is there, then chances of peritonitis is also there. These are the common complications. Hemorrhage, abscess, and recurrence of metritis. Metritis in the sense that sometimes what will happen if you are not going to cut this uterine body properly, then chances of infection is there in this vaginal end, and this is most common complications seen after this ovarian hysterectomy. Then this important point about ovariectomy is after an ovariectomy, bitches tend to put on weight 10 kg after 10 days. Weight regain is there, so 90 days after 90 days. And metabolism of bitches falls from 37 to 33 kilocalorie per day. It is important to reduce the daily ration by 10%. After the ovariectomy, this is important message that you just cut down the 10% ration, whatever you are prescribing before this ovariectomy. If you are not going to follow this, then definitely this weight gain is there. Now, next topic is next one is this ear cropping, and this is ethically not permitted, but at least you should know the important things about this ear cropping. I will discuss anatomy, legal status, surgical process, and post-operative care of this regarding this ear cropping. Then, what is ear cropping? Cropping is removal of part or all of the pinny or auricle, external visible flap of the ear and ear hole. This is the mostly this is people used to come for this type of surgery. अपने डॉग को अच्छा देखने के लिए कान खड़ा रहेगा, then your pet will look better. But it is banned in many nations, but it is still legal permitted in limited number of countries. and it is seen only in some breed like pit bulls, Doberman, Pinscher, Red Den Boxer, and Cane Corso. These are the some breeds in which this ear cropping is recommended. Indications already I have discussed. Owner fancy, wants to see his or her pet beautiful, and for this purpose they used to come for this ear cropping. Then many times this correction of irreparable injury. If dropping ear is there in case of many breeds, then this is also recommended in this case also. And reduce the possibility of aggressive dogs getting a hold on them, and reduce the chances of ear infection. This is also recommended for this. This surgery is also recommended to reduce infection in ear canal and all this ear canal. Age of ear cropping. No, this is the real age for ear cropping. This is very important. You remember these things. 2 to 3 months. Anesthesia already I have discussed. Without general anesthesia, it is not possible to perform this type of surgery. And site of operation is lateral border of ear flap. Always you use to cut this ear through lateral side, lateral border. These are the some types of ear crop. This is long ear crop. This is so crop. This is short ear crop. This is petal crop. These are the important long ear crop, long crop, soft so crop, short crop, and petal crop. These is recommended. This type of cropping is noticed and used to perform these type of things. Legal status. Because this is very important. This cruel procedure were originally banned by the Veterinary Council of India in 2011. That's why PETA India fired off letters to numerous Indian veterinary regulatory bodies, including the Veterinary Council of India. So that's why this operation is not legally permitted, or because already whatever ear and whatever organs animal is having, it is its own, and you are going to going for this type of surgery only for his beautiful look. So this is not permitted. This is not good, and this is most commonly banned here and not permitted in many institutions. Surgical anatomy, all these things. These are ear canal, horizontal, vertical. These are the eardrum, and internally this is tympanic villi. This is lateral crus of mostly these used to perform this cropping to this lateral border only. Don't go for this medial border. Always ear cropping is recommended through this lateral border. These are the some artery. This is internal auricular branch. This is medial auricular branch. This is lateral auricular branch. And these are the branches of this stylomastoid artery. So try to avoid cutting this. If you are going to perform this lateral side, then you have to ligate this lateral auricular branch perfectly. Then automatically you will going to have this good ear cropping. These are the instruments which generally used to recommend for. These are the ready-made instruments, and for different type of beats, different sizes is there. For Doberman, for Red Den, for Boxer, for Boston Terrier, and many already this type of instrument is available in market. Surgical process. Before this, you just apply this ear clamp, whatever recommended for particular breed, applied from the upper to lower points of latent ear flap so as to adjust the flap to the desired shape. Whatever shape you are going to give to that particular ear, you apply particular clamp there, and you just a concave curve made by pulling ear flap laterally through the clamp, and convex curve pulling ear flap medially. This concave one should be outer side, lateral side, and this convex one should be in medial side. So by putting this ear clamp, you remember this. And this lateral portion of ear flap is excised by cutting along the clamp, and bleeding is controlled by using either electrocautery or by ligating this. Auricular ear cartilage is trimmed with scissor at the base of ear flap. This is important because if you are not going to cut this ear cartilage, then healing will be hindered. And simply, upper two-thirds of ear flap is closed, skin to skin. Just you expose the skin and you cut cartilage, and then again you suture this skin, so that by putting this simple interrupted suture, so that healing is there. Thank you. This is all about ear cropping. Then next one is ducking. Alok, you take attendance, please.
जी sir.
So this is docking. Docking, this is tail docking, and this is medical procedure to done remove part of the tail in puppies. Mostly this is in puppy, and in larger dogs, mature dogs, you can say. Tail docking is performed when any crushing injury is there. It will be discussed later. Tail docking is performed on working dogs to protect their tails from injury. And for this, this is recommended. Length is very important. Length, that it is varied from breed to breed. Currently, 62 breeds recognized by AKC have dog tail, Cocker Spaniel, Rottweiler, and Yorkshire Terriers, and many more. Some dogs, such as English dog, Sheepdog, this is recommended for some breeds also. But this is also not ethically good if until and unless if the animal is not having any crushing injury or any severe infection, then this is also not recommended. And docking is for prophylactic use also, therapeutic use also, for cosmetic purposes, and to prevent injury. This procedure was also originally banned by Veterinary Council of India in 2011. This is also banned. So this type of surgery, even docking and ear cropping, is not legally permitted. So try to avoid these type of surgery in healthy animals. If until unless the animal is not having any severe infection, severe injury to the tail. So try to remember these things whenever you are going to perform this surgery. Equipments, docking knife, tourniquet. Tourniquet is not an equipment. Tourniquet is just by putting bandage over the posterior side of operation. Docking knife is also available. If pup is there, then docking knife is sufficient for this type of surgery. Anatomy of tail is very important. You just remember where this vessels is situated. Then cross section of tails, very muscles. This is muscles is there. Sacrococcygeal dorsalis, sacrococcygeal lateralis, then intertransverse cauda, sacrococcygeal. These are the important sacrococcygeal dorsalis, lateralis, and ventralis muscles. These are the muscles situated here, dorsal side, lateral side, and ventral side. And vessels is very important. One medial vessels is there. Medial side, if you get here, then below. This is the lateral side. These two are lateral coccygeal vessels, and below this medial side, one medial coccygeal vessels is there. So ligation of these three vessels is very important. Otherwise, sometimes severe bleeding will be noticed. And if severe bleeding will be noticed, then sometimes panic situation is created. So try to ligate these vessels properly. Lateral caudal vessels, these are the side. This is the medial caudal vessels. So that if you will ligate these vessels perfectly, then it will be easy to perform this surgery. Age is recommended age is 5 to 7 days. Miss 10 days is sufficient, but sometimes what will happen? Owner used to come after 1 month. So perfect ligation should be there for these lateral caudal vessels and medial caudal vessels and this medial coccygeal vessels. Healing is uncomplicated. Sometimes tail always animal used to move tail. So these are the sometimes complications is there for, regarding this wound healing. The specific area, this is very important. The specific area for cutting this is 2/3 in terrier, 2/3 portion of the tail, 1/3 in cocker spaniels, half in poodle, leave only 2 coccygeal vertebrae in Doberman. So these are the some recommended portion of cutting this tail for docking. Remember this thing. This is very important. And for surgical procedure, clip this area aseptically, retract the skin proximally, and clamp the tail. Just you clamp the tail and then you go for this job. Immobilize the tail. Already you will perform this surgery by this general anesthesia. Palpate the desired site, desired transaction site, and transect the tail between adjacent caudal vertebrae. You have to put this incision in between these caudal vertebrae. Then only it will be good for removal of this. Otherwise, if you will cut vertebrae in between that, then some complication is there. Extend the retracted skin. Whatever skin will come, you just remaining tail and assess the tail length and resect more if necessary. If you think that some more portion used to cut, then you go for further. Otherwise, by simple putting 1 or 2 interrupted suture, it will be sufficient to complete this surgery. This is also very easy, but try to avoid this surgery if animal is not having any type of wound in type of gangrenous tail is there, then you go for this type of surgery.